Hello everyone, my name is Georgina Kwa and I would like to warmly welcome you to our Phoenix webinar entitled Health, the New Asset Class. In this time of pandemic, personal and public health are on everyone's mind. Over the years, keeping fit and staying healthy are a significant growing trend among young people. In terms of COVID-19 risk management, safety hygiene, staying healthy and building up our immunity is one of the defenses against COVID-19. Personal health today is valued more than ever, but the question today is, how do we build up this asset? We are very pleased to bring to you to our webinar our esteemed speakers who will share with you some insights to the future of healthcare, what and how we can do individually to invest wisely and consistently in our health. As with every episode of the Phoenix series, we will showcase a key landmark of National University of Singapore. For this episode, what would be more fitting than the birthplace of music in NUS, Yong Siu To Conservatory of Music, as they say, music heals and strengthens the soul. Founded in 2003, YST is focused in its Bachelor of Music program where undergrads specialize in one of the 20 majors in instrumental performance, voice, composition, audio arts and sciences, music and society, collaboration and production. Keenly focused on nurturing identity as a driver for excellence, the conservatory has quickly established its reputation in Asia and the world and is supported by the Yong Lu Lin Trust and other donors. Further, YST Master of Music program, second majors, minors and modules for the NUS students, CET courses, young artist programs and the extensive concert calendar open up more ways for the community to engage in music. Wow, don't you just love this place? It's so beautiful! Let me now introduce our first speaker, Prof. Chia Kee Seng, a professor in public health, also our founding dean of NUS Saw Swee Hock School of Public Health. He will be sharing with us on the topic, a message to the younger generation, those under 30s, health and wealth. How do you think the COVID-19 pandemic has changed our views towards health?
Well, it's very obvious that this COVID-19 is a great disruptor. It disrupts personal life, it disrupts our work, it disrupts national economy, global economy. So it is indeed a great disruptor, and it demonstrates how a health issue actually has so many ramifications. It kind of highlights that a health issue can have great impact in terms of our ability to create wealth. But my concern is that this is actually short-lived.
What do you mean when you say this greater awareness of health issue is going to be short-lived?
Well, this is not the first health issue or health crisis that Singaporeans have experienced. We had SARS, right? We had swine flu, or what we call H1N1. And today we are also having dengue for so many years. In fact, the number of deaths from dengue this year is about the same as the number of deaths we have for COVID-19. And with time, somehow it's in human nature, we tend to downplay risk. And what is constantly there, with time we tend to almost like forget about it, right? And vaccine is a good thing, but when the vaccine becomes more available and effective, we'll probably begin to start forgetting about COVID-19. The other point is that it is also human nature that we tend to jump from one area to another, one health issue to another health issue, without seeing the link between them. Today, we focus on COVID, we focus on infectious disease. We forget that those with chronic diseases like hypertension, diabetes, or even just being overweight actually are at higher risk of complications and death from COVID-19. We have a war on COVID-19. we forget that we also have a war on diabetes at the same time. And the two are actually linked. And this have to change. This mindset of risk reduction or risk discount, as well as this mindset of jumping from one issue to another issue must change in order that we can be more prepared for further waves of COVID-19 or something worse than COVID-19, the dreaded disease X.
How then can we put more emphasis on health, especially when there is a possibility of a disease X?
I think we kind of have the mistaken notion that we can change the behavior of individuals just by providing more knowledge. And after all, in dealing with such health issues, it is about changing of behavior. And we may think also that we can just change behavior by providing reminders at the point of decision. Say, I know that we need to eat healthily, right? And then maybe my handphone or my digital watch will remind me when I'm ordering food. Then, my behavior, my adoption of healthy lifestyle will be there. I think we need to go deeper than that. We need to know actually what drives us. What is our value system? And how do we define success in life? I think we have defined success in life as an accumulation of wealth. This is especially true for us who are in what we call the pioneer and merdeka generations. Those who are, like me, over 60 years of age. And we have unconsciously pursued wealth at the expense of health. We spent the first 20 years of our lives at school, for what? Well, to build habits, to learn skills, to create wealth. We then go to work and we work hard in the pursuit of wealth, often ignoring our health. Then finally, when we retire, we often find ourselves actually with ill health and becoming frail in spite of our wealth. And those of us who are, 60 and above, we are so good at it that we have actually passed this value system to the next generation. Those people who are between 30 to 60 are also driven by the same value. Success equals to wealth, right? And I think this has to change, especially among those below 30 years of age.
What do you mean by changing our societal value system into one that values health just as much as wealth?
Well, don't get me wrong. I'm not saying that it is wrong to have wealth as a measure of success. But I think what is wrong is to use wealth as the only measure of success. We must at least include health as a measure of success. We must go to the level whereby we value health just as much as we value wealth. What this means is that perhaps we should think about spending the first 30 years of our life in building and developing habits and skills to create both wealth and health. The reason is, I think between the age of 15 to 30 is a very, very important transitional period. People who are going from secondary schools into institutes of higher learning, junior colleges, Institute of Technical Education, polytechnics, universities. That is a very important transition period to develop this new value system. And the second transition would be from institutes of higher learning into working life. And the first 10 years of working life, employers must recognize that I am investing in my workers to both develop skills as well as habits to not just create wealth, but create health. So that in the long run, you will have employees that will be able to continue to create wealth and create health and be able to enjoy their wealth in the old age.
How can we take advantage of these two transitions to develop this new value system, or valuing health just as much as wealth?
So the time in the transition from secondary schools to Institute of Higher Learning, it's a very important period. And what I think is important is that if our institutes of higher learning would set for themselves a vision of not just producing manpower to meet the economic demands of Singapore, but also to produce cohorts of lifelong healthy learners. Well, there will be people, within whatever age range, a small proportion of people who will be unwell or at higher risk, much higher risk than the general population in terms of developing diseases, especially chronic diseases, right? When I was a medical student, for example, I don't see a diabetic below the age of 50. Now you see many young people who are diabetic. Right? So what's the advice for these people who are young and already have chronic diseases? I think one key is to recognize that you may have undiagnosed disease and therefore the need to go for screening, the need to be diagnosed with that chronic disease. Second thing is, look, having something like a chronic disease doesn't mean the end, right? Having something like a chronic disease, the very fact that it's called a chronic disease is that it is something that's going to be with you for a long period of time, right? You then have to manage it and prevent the complications that come with the chronic diseases like diabetes. So I think the important thing is that for those who are in the relevant age group, to need to go for screening to try and identify whether you have chronic diseases. And for those who have been diagnosed, that it is important to recognize that it is not the end. You need to follow the medication. You still need to follow a healthy lifestyle to prevent the complications that comes towards the end. As a society and as individuals, we tend to define success as the accumulation of wealth. We need a new formula, we need a new definition of success. Success is both wealth and health. We need to value health just as much as wealth.
Thank you, Prof. Chia, for helping us recalibrate our approach on health and wealth. It is indeed timely, as we know good health and immunity is a key defense for COVID-19. It is therefore my pleasure to introduce our first of two special guests besides our panel of speakers to give us more insights on the views of COVID-19 1 year on. Thank you, Dr. Elvin, for joining us today. I understand you were part of the SARS epidemic medical cohort in managing that disease back in 2003. Please share your perspectives of the two diseases, SARS and COVID-19, in both the disease, treatments, and mitigations.
This recent pandemic has brought back memories of the middle of March in the year of 2003. At that time, my third child, my daughter, was born, and a few days later, the coronary care unit of Tan Tock Seng Hospital was shut down. Why? Well, because SARS visited Singapore at that time. It was a largely unknown illness. In fact, when the second super spreader was admitted into the CCU that afternoon, I was just 3 meters away from that patient. She was admitted to the coronary care unit because there was difficulty at the time to differentiate clinically between heart failure and pneumonia, which was caused by SARS. So she came into my department as a patient with presumed heart failure. Unfortunately, at that time, with very little recognition of this infectious disease, the entire team rushed into the room to save her, including a particular Dr. Ong, and he got the brunt of the exposure that afternoon, and he subsequently passed on after having spread it to his mom, who also passed on. So my remembrance to the both of them after 17 years. The entire team in the room came down with SARS. And because of that, the entire coronary care unit, for which I was director at that time, was shut down. It was a difficult time. This recent pandemic really brings back those memories of how it all happened. And this COVID-19 is actually not much different from SARS. In fact, it has been renamed from the Wuhan virus by WHO to the SARS-CoV-19 virus. Why is that? Because there are similarities. And because of that, we have learned much in the past 17 years of how to deal with this pandemic. Now let's look back at SARS. SARS ended quickly, quicker than we expected. Thank God for that. It was much quicker than we had hoped, and the mortality was much limited because of that. Because in terms of understanding the virus, we would call SARS a stupid virus. Why? It killed off its host quickly, reducing the chance of spread. A dead person, unless there's poor hygiene, which happens, especially in the cases of like Ebola in African countries, unless there's poor hygiene, the chance of spreading of the SARS virus was very limited. So SARS killed off its host very quickly, and therefore, for some odd reason, the spread stopped, much to our surprise, our pleasant surprise. But this virus, the SARS-CoV-19 virus, the COVID virus, is a smart virus. It mutates because it wants to be part of us. It mutates so that it can be accepted by the host, the human being. So that's what's been happening. And of recent past, we have discovered 3 mutations in South Africa, Brazil, and from UK. So when the virus is challenging us at a global scale, we try to unite ourselves and we try to meet the challenge face to face. So it's a very important piece of history that we will bring to our posterity, and how much we learn from this is very important to pass on to the next generation. And of course, for ourselves as a nation, a small red dot in Southeast Asia, we must survive so that we can fight another battle another day. And it's exactly the influx and outflux of people that spreads this virus.
With the vaccinations and herd immunity, are we home free? That is, can we get on with our lives like pre-COVID?
So there was a lot of uncertainty in the early days. We were led in large by WHO, which of course is the World Health Organization that should be leading the fight against a pandemic. As it evolved, we slowly began to learn important lessons. One was that whether it's aerosol or droplets, masking ourselves on the face is most important. It protects both the other person and ourselves to some degree. Whatever mask we use really didn't matter. It could be a cloth mask, a surgical mask, or even an industrial grade mask like the N95 series. The herd suggests that it has to do with sheep and cow and livestock. It's exactly what it is. The livestock of the community. That means the community at large, whereby the community is safe and protected. And how do we achieve the immunity? People achieve immunity from a disease through two ways. One is through an illness. One is through vaccination. We want to avoid the illness because the outcome and the journey of the illness is uncertain. Although many people have recovered, especially like I mentioned earlier, amongst those from the foreign workers dormitory, they've recovered really well. We cannot be certain that we ourselves would be doing just as well. So vaccination is the key. And clearly this is the way to go in the whole world. Now vaccination really means exposing the healthy community to little bits of the virus in a safe manner. And therefore the body builds an immune response to this stimulus, and therefore the body is protected. That is the purpose. We are not unfamiliar with vaccination. In Singapore, as a child, we have a very robust immunization schedule for children. And amongst those vaccines, two of them are actually mandatory because of the terrible diseases that those viruses bring. So we are familiar with measles, mumps, and rubella. We are familiar with polio vaccination. So what's the big deal about this particular vaccine for this new virus? Now, there are more than 60 vaccines being studied, not just those that are published in the newspapers daily. The first one that has been available to Singapore has been an mRNA-based one, and like the government has mentioned, whatever is available, please take it. Just take it. You will largely be safe, in fact, very safe. You may feel some minor side effects like everyone does for vaccination, but at the end of the day, you are contributing to the herd immunity. This vaccination program is not largely for yourself. It's also for your fellow community people, your fellow Singaporeans and the residents of Singapore. Only then will we have an opportunity to be able to go back to normalcy.
Finally, Dr. Alvin Ng, how does the notion of health and wealth come together in this equation of success?
The old adage of health is wealth rings true in this pandemic. But at the end of the day, just take care of yourself in the most hygienic way. Washing your hands, keeping yourself at a social distance from other people does not require money. So there are a certain community health-based approaches that can be cost-effective. Then there are those that are more expensive. So my take-home message for everyone is that health is wealth. It is important to keep yourself safe through inexpensive measures like wearing your mask, keeping your social distance from others, washing your hands. And then you leave the expensive things to the government to deal with, and then when you're needed to participate in it, please participate. This pandemic really shows how health and wealth comes together in a global fight with a common enemy.
Thank you, Dr. Alvin Ng, for your insights. Next up, we have Dr. Yong to share with us his thoughts.
Dr. Yong Chen Chet is the founding Chief Operating Officer for Good Doctor Technology, a Southeast Asia region early-stage digital health startup headquartered in Singapore with a simple but profound mission of enabling better healthcare for all. Good Doctor does this by creating a digital new normal for healthcare delivery and applying AI, machine learning methodologies to amplify human doctor capability and productivity. What does health being a new asset class mean to you?
Hi, good afternoon everyone. Thank you for having me to be part of Project Finish. So my role today is I'm going to talk about health as a new asset class, looking at what are the options that we have in the future. Now, the way I interpret the statement is that if we look at health as something valuable and something that we want to preserve, not only for ourselves, but maybe for our future generations and our impact onto the family, why is it that the services that we have nowadays are very much focused on the recovery of health, or in fact, only in what I call the disease management space, right? So let us maybe look into what options do we have going into the future. And in fact, before we even go there, let me take a step back to actually present to you the common reasons why, right? So here we're looking at the reasons why people are going into seeking healthcare services. Number one is about when you are in a sense of urgency, discomfort, or pain. Now, this is the types of services that we are most commonly familiar with, and it is something that is readily available and it is technically considered well served. If you look at the slide that I'm sharing with the audience, below the black line, there are actually two more major reasons why people seek health and wellness services. One is when you have a long-term goal or objective that you want to achieve, or in fact, you want to maintain your current state of good health. Next, something that is not so obvious is the fact that we actually seek out a form of support or a community when it comes to managing our health and wellness issues. These two, I feel that right now, these types of services are not so well circumscribed, but this is where the opportunity is and the gap is. So going back to the statement, health is the new asset class, I believe that these are the areas that are going to be the future opportunities.
What are existing health service delivery models?
Okay, now, if you look at the row where you have the green highlights, you can see that services are beginning to be based more of a maintenance and a monitoring kind of approach. So these types of models are in fact very much better at managing our chronic disease or achieving a certain health goal. And then lastly, if you look at the blue highlights, this is basically where we are starting to move into the new frontier. And you can see that the brands that I put on might not be too familiar with all of us. So Hello is actually from Amazon, and Mirror is basically a spin-off that has been acquired by Lululemon. So these are basically membership-based, these are based on wearable data technology, and is based on a continuous tracking engagement purpose. So you can see that we are moving from facility-based all the way down to a platform-based. And I think the takeaway from this slide is, besides being aware of what are the options we have today, look at the targeted outcome spectrum, and you can see that from a therapeutic and curative outcome, we are slowly moving into something that is about optimization and enhancement. So this sounds more like managing our health as an asset versus only starting to do something to it once the potential is lost.
What are your thoughts regarding the reimagination of healthcare in the future?
Okay, so now with this, I'm going to go on to my second section to talk about new health system. If we think about health reimagined, what you see right now on the diagram is that you will actually see the traditional health stakeholders. For example, the providers, which is the medical capability as well as the diagnostics. The patient, which is the center point, as you can see right in the middle of what looks like a spider web. That's the nexus of the health system, right? And surrounding it, you have the producers, you have the pharmacies, which is the distribution, and you can see right on top, you have the policymakers, the payers, as well as the processors, right? So how do we then move from the traditional stakeholder system, which I call the Ps, into a platform partnership type of business? So if you imagine that the spider is actually resting on the web itself is the platform-based model, because we now, each of the different points of the web, which is the Ps, are actually existing in independence and in silo. So only because now we're beginning to have digital platforms that form this type of interactions, we are able then to say, okay, is there ability to measure health and wellness? Lest we forget, our traditional system is a sick care-based system, meaning we measure disease and we measure rate of recovery, but there's no system without this that will measure wellness. So one example, which I'll share with the audience today, is I talk about engagement, awareness, and results shown. So I use the analogy of ears, as in literally our ears, because if you want people to be healthy they need to listen to you, right? They need to be able to subscribe to a certain way of life, and they need to maintain a certain set of good habits. So the ability to listen, it is described by having ears. Are they engaged? Are they aware? And to keep people motivated in the form of a gamification, for example, it's all about showing the results. That means, are your fitness level getting better? Is your waistline actually getting healthier? Are you able to exercise well? Is your resting heart rate improving? So these are all the things that, in fact, you start to hear more and more often, and because we have variables that are able to track all this data. Now, it's because the fact that we do have this capability today, going forward in the future, we do have an ability to have what I call a system of true wellness, right? As opposed to our previous system where we call it healthcare, but actually it's very much sick care in a sense. Okay, so now, final section, how do we simplify this whole area of wellness into a very simple concept that I think all of us can walk away with today, all right? So I'm going to use the analogy of a compass, right? If we all recall a compass, it is a guiding point and it points towards the direction where we want to head. So in my concept of wellness compass, I have simplified the 6 dimensions of clinical wellness into the 4 compass points. So first we start with the north point, which is the nutrition, right? So nutrition is basically very key and very important, but at the same time, it is something that it is very hard to simplify. But we put it as the north star of the compass, nutrition. Next, when you look at the south, as in the S, it is sleep. I think this year we're all very aware that sleep health has become forward, front and center because of the COVID pandemic, and the fact that work from home, in fact, has also interrupted our sleep schedules quite a lot. So sleep awareness and sleep health is already at the forefront. Then, if you look at the east, which is emotions, right? Before this, in terms of mental health and in terms of tracking, we do not have the ability to continuously monitor our emotions. How do you know when you are on that Zoom call? Are you stressed? Are you relaxed? Or when you are actually trying to prepare for a meeting, are you all right? Are you confident? So today, we're starting to get technology, especially in the wearable space, that do have the sensors that actually enable emotional tracking. So what sensors are they? Example, skin temperature variation, electroconductivity. In fact, the capability from Amazon Halo, which is one of the brands that I put up before, they actually listen to the tone of voice, meaning they can detect whether you are in a stressful situation or you are relaxed, just based on the tone of voice, okay? So these are all possible nowadays. And then last but not least, the west point, which is the W, is basically about workout activity. And this is where the origination of wearables have started. Step tracking, exercise, calorie burn, heart rate. So this space is well circumscribed. But when you bring all this together into a model as such, this is basically how we can able to track wellness, all right? So there's a lot of complex research all done behind this, but what I'm trying to say is I'm giving you a possibility that there is a way of actually executing a wellness health system going forward. So now I'll go into my 3 takeaways for today. We believe by actually applying the teachings that I've just shared, we are able to create this new form of health system that in fact will actually save a lot of people from actually becoming sick in the first place. So with that, thank you so much for allowing me to share my message, and I hope that this has been very useful to everyone.
Let me tell you more about myself. I lead the Open Innovation function at Roche Diabetes Care Region International. Our goal is to provide true relief for diabetes patients through an integrated and personalized diabetes management system. Often, we work closely with international partners of both physical and digital ecosystems, corporates, government, as well as startups. By the way, I'm a graduate from NUS with a degree in Arts and Social Sciences. Being part of this episode feels like home to me. Now, being in the life science healthcare industry and through the course of my work, I like to share how corporates transform healthcare to help people with better health management. Today, healthcare is experiencing unprecedented change and disruption. it is becoming increasingly complex with demographic pressures, exponential amount of data, changes in technology, diagnostic approaches, and new models of care, further accelerated by the COVID-19 pandemic. There are also increasing expectations towards a healthcare system shift from just delivering goods and services to achieving improved patient outcomes while reducing cost. As a producer and a provider, we want to make a radical shift towards improved patient outcomes. This means transforming from a supplier of drugs and medical products to being a partner and an enabler in changing and improving healthcare for humankind. To create healthcare that is sustainable, built on people's needs, strong data, and clinical insights. Healthcare that saves lives. Here's Roche Diabetes Care's vision, where we believe by 2025, we will help people with diabetes everywhere in the world think less of their diabetes routine and get true relief day and night. To achieve our vision, we have identified 3 key priorities targeting various stakeholders in the healthcare ecosystem. 1, improve care along patient journey to really provide disease management solutions along the entire journey to optimize care. 2, enable confident healthcare decisions. We build internally and partner externally for high-quality data-enabled applications, predictive analytics, and workflow solutions that support clinical decisions making. 3, drive medical values by developing integrated testing solutions. Solutions that actually combine hardware, digital solutions, services to address the needs of our customer segments. To share some examples of how corporates are doing this, let me refer to chronic disease management. Take diabetes, for example. We are adopting a strategy called Integrated Personalized Diabetes Management, in short IPDM. If you take a look at the diagram here on the screen, you would see the patients in the middle of the ecosystem. But to help patients better manage his chronic conditions, it doesn't only include him. For the entire ecosystem, you would see healthcare professionals, the caregivers, hospitals, the payers, even policymakers, as well as the nurses. And what we call the IPDM really helps to enable patients to master the complexity of managing diabetes through this network of people that we are also making sure that it's integrated into the diabetes management system. In short, IPDM here intends to delay the impact and the effects of the chronic condition. So there you have it. IPDM is our transformative approach to better health and wealth. Dr. Andrew Tay is currently the Head and Director for Health and Wellbeing in NUS. In his current role, he leads and drives the university health and well-being strategies to enhance the resilience of the employees.
NUS cares for your health and well-being and is doing more to ensure that we can be at our best in achieving our personal and professional goals. To this end, NUS has established the Health and Wellbeing team in November 2020 to drive the university's health and wellbeing strategy. So health and wellbeing is an important concept that is rapidly gaining traction among companies. So globally, we see multinational companies establish the health and wellbeing centers of excellence, such as Google, Microsoft, GlaxoSmithKline, Johnson & Johnson, and Shell. Locally, our government has long advocated the integration of health and wellbeing considerations through the Total WSH approach and a variety of workplace health promotion programs by the HPB. So when we think of health, it is intuitive to think of the body as free from the disabling impact of conditions and illnesses such as diabetes, heart conditions, or physical impediments. Well-being, on the other hand, takes a step further and considers how we can continue to cope with the stresses of the world, be productive, and have a meaningful contribution to the community. At the end of the day, one can safely say to have a good state of well-being when one can say, this life has been meaningful. Everyone plays a part in this journey of health and well-being. Over the years, the university has invested in staff welfare benefits such as medical and wellness services on campus, employee assistance program, fitness facilities, among others. In July 2020, the Office of HR has also enhanced our employee medical benefits to provide coverage for mental health. The Office of Risk Management and Compliance, or the ORMC, will also formally register employee health and well-being as a discrete institutional risk to manage accordingly. So all these initiatives, coupled with the establishment of the health and well-being team under the President's office, reflect the university's commitment towards staff health and well-being strategy. In addition, the team will embark on a 6-month-long Are You OK campaign aimed at driving resource awareness, addressing stigma on mental health, and setting a positive tone of psychological safety, empathy, and inclusivity on campus. So if health takes the analogy of a car, then well-being is the driver. Our body may possess a healthy set of engine and working parts, but without a good driver, or if the driver is sleepy, it will be difficult to realize the full potential of what the car is meant to do. We can take steps to be our better selves each day. For a start, we should be kind to ourselves and observe good tips on self-care, such as observing good sleep hygiene, being thoughtful in our food, integrate bits of physical movement into our daily lives, undertake regular health screening, and stay connected with our communities. And if I may add, take the COVID-19 vaccination if you are eligible. Take some time to understand the employee benefits that the university has provided for us. I recommend that we first take a look at our medical benefits provision and the employee assistance program, which is free for our family members as well. If, like me, you are a people manager, let's take time to constantly upgrade ourselves to stay relevant in the way we communicate, engage, and inspire our team. To help the managers in this journey, the Health and Wellbeing team will work with the Office of HR to incorporate mental health guidance into our existing suite of learning programs. In closing, health and well-being is a shared objective. If everyone plays our part, we will do well in facing the challenges of a VUCA world.
We hope you have enjoyed this episode and have been enlightened on how to take care of yourself, as after all, you are your most valuable and irreplaceable asset.